The heart is a complex organ composed of 4 chambers, blood vessels, and valves that work together to pump blood throughout the body. Teaching nursing students about the anatomy of the heart is crucial in preparing them to provide effective care to patients with cardiovascular conditions. The heart has 4 chambers, 2 atria and 2 ventricles, that are separated by a septum. The right atrium receives deoxygenated blood from the body through the superior and inferior vena cava, while the left atrium receives oxygenated blood from the lungs through the pulmonary veins. The right ventricle pumps deoxygenated blood to the lungs through the pulmonary artery, where it is oxygenated, and the left ventricle pumps oxygenated blood out of the heart through the aorta, which distributes it to the rest of the body. The heart contains 4 valves that prevent the backflow of blood and ensure the proper flow of blood through the heart. These valves include: 1. Tricuspid valve, separates the right atrium from the right ventricle. 2. Mitral valve, separates the left atrium from the left ventricle. 3. Pulmonary valve, separates the right ventricle from the pulmonary artery. 4. Aortic valve, separates the left ventricle from the aorta. The heart is surrounded by a network of blood vessels that supply oxygen and nutrients to the heart muscle. These vessels include: coronary arteries. These arteries originate from the aorta and supply oxygen-rich blood to the heart muscle. Superior and inferior vena cava. These are the 2 largest veins in the body, which return deoxygenated blood from the body to the right atrium. Pulmonary arteries and veins. These vessels transport blood between the heart and the lungs, where oxygen exchange occurs. Aorta. This is the largest artery in the body, which carries oxygenated blood from the left ventricle to the rest of the body. Heart conduction system. The heart has a specialized conduction system that controls the rate and rhythm of the heartbeat. The conduction system includes the sinoatrial SA node, atrioventricular AV node, bundle of His, and Purkinje fibers. The SA node is located in the right atrium and acts as the natural pacemaker of the heart, sending electrical signals that initiate each heartbeat. The AV node is located between the atria and ventricles and acts as a gatekeeper, slowing down the electrical signals before they are transmitted to the ventricles. The bundle of His and Purkinje fibers transmit the electrical signals rapidly throughout the ventricles, causing them to contract and pump blood out of the heart. The anatomy of the heart is a complex system that is critical for the proper functioning of the cardiovascular system. By understanding the anatomy of the heart, nursing students can effectively identify and manage cardiovascular conditions, assess patients' vital signs, and provide proper care to patients with heart-related conditions.